There's certain things that are not covered at all. For instance, routine dental, routine vision, hearing exams, and hearing aids are not covered on a routine basis under Original Medicare. Medicare doesn't cover annual well woman exams. They do that every 2 years. Annual physicals are not paid under Medicare. They do have something called a new to Medicare wellness visit and annual Medicare wellness checkups, but physicals are not covered. So if you're used to having that and you want that type of coverage, you may have to consider something like an Advantage plan to have the physical. If you're going to go with Original Medicare and a supplemental, you may want to educate yourself on what is covered on the Medicare annual wellness exams and make sure that that's going to be adequate for your needs so that you're not ending up having to self-pay significant costs. The other big thing is Original Medicare A and B do not cover outpatient prescription drugs. So that's something that you have to buy additional coverage to make sure that you're covered for your prescription. So it's official. You know you need to take Original Medicare Parts A and B. What do they cost and what do they cover? Medicare Part A is known as the hospital portion of Original Medicare. When you have Medicare Part A, you have a red, white, and blue Medicare card that says Part A Hospital and an effective date. Your Medicare number is an 11-character number combined of digits and letters that make up your unique identifier for Medicare. Now, when you have Part A, you have what's known as hospital coverage under the Medicare program. Fortunately, most people don't have to pay a monthly premium for Medicare Part A, and that's because you already paid in while you were working at least 10 years or 40 quarters. Now, if you never worked but you were married to someone who did, it's possible you can draw Medicare benefits through their number and also be entitled to premium-free Medicare Part A. However, if you were born outside of the U.S. and didn't work your 10 years or 40 quarters or didn't work very much and are not covered as a dependent of a spouse who did, you may pay substantial premiums for Medicare A depending on your number of quarters working in the United States. Fortunately, for most of you, you won't have to pay again for Medicare A costs. Now, Medicare Part A is really important coverage under the Medicare program. The three key things that are covered under A are going to be inpatient hospitalization, room and board, skilled nursing facility care or SNF care, or hospice care for terminally ill patients. Now, Medicare covers these very important services, but it doesn't cover them all 100%. For instance, if you're admitted to the hospital, Medicare Part A has a benefit window deductible. The deductible for calendar year 2026 is $1,736 your first minute in the hospital per benefit period. So what does that mean? It means that if you're admitted to the hospital and released and readmitted within 60 days, which is known as the benefit period, you pay the $1,736 one time. However, if you're released and readmitted after 60 days, even if that happens multiple times within the calendar year, each time you'll need to pay the $1,736 again. So the Part A hospital deductible can be quite significant under the Medicare program. Beyond the deductible, you could be covered in the hospital for your room and board for up to 60 days with no additional cost. Fortunately, most of us don't stay in the hospital more than 60 days in a row, but if you did under Original Medicare, you would share in much more meaningful costs in terms of daily copays for hospitalization. Beginning at day 61 through day 90, you would be paying $434 per day in 2026. And if you needed to stay longer than 90 days in the hospital, you would tap into the lifetime reserve days, of which you get 60. Starting at day 90, it would be $868 per day. Under Original Medicare, if you're in the hospital more than 150 days in a row, hopefully you never are, but you're actually on your own for the room and board cost. So a lot of this is the reason that people choose additional coverage to cover against a situation that could be catastrophic in terms of hospitalization. So we'll touch on that a bit later. The point is that Medicare A covers this important service of inpatient room and board in the hospital. It's not an unlimited benefit, and you do share in some of the cost. You also can run out of coverage if you're there for a lengthy stay, and having additional supplemental coverage probably makes a lot of sense in the hospital. It's also important to note that hospitalization coverage under Medicare Part A is known for the room and board in the hospital. So that's your hospital room, that's your hospital bed, it's the IV you're using, it's the nurses coming in, it's the TV, it's the fancy food, right? That's all Medicare A. However, if you see a doctor when you're in a hospital or you need a surgeon or an anesthesiologist, those services are physician services and actually can fall under Medicare Part B. So there can be additional charges that you need to be aware of, and we'll talk about that when we cover Part B in a moment. The second most important benefit that comes under Medicare Part A is for skilled nursing facility care. This is what often happens after a hospital stay. Maybe you have a situation where you've had a stroke or a hip replacement, something significant where at some point you're well enough to leave the acute hospital, but you're not yet ready for home. You need to go to skilled rehab. Medicare B or Medicare A does cover days 1 through 20, 100%. But if you need to stay longer than 20 days, Medicare will cover you up to 100 days in a row in skilled rehab. But beginning at day 21, there's a daily coinsurance of $217 per day from days 21 to 100. Once again, with a supplemental or an advantage plan or something to fill the gaps, you can likely close the gaps on that $217 per day should you need it. Now, it's important to note under Medicare Part A is if you go over 100 days or even within 100 days, your level of care drops below a skilled level, that's considered long-term care and it's no longer covered by Medicare or by the supplemental plan. So that's something to consider. One program where Medicare really does it right is with hospice. So for terminally ill patients, Medicare will pay 100% of comfort care for those terminally ill people. And so it's a wonderful benefit. It's covered in full to keep a person comfortable, but it is important to note that that does not include the room and board at your facility. It's just the medication and comfort care covered under Medicare A. So in a nutshell, Part A is an important part of original Medicare. It's the hospital portion of the coverage. For most people, it's going to be premium free. The biggest benefit it covers is room and board in the hospital, but it doesn't cover it 100%. That's A in a nutshell. Medicare Part B is what they call the medical portion of original Medicare. When you have Medicare Part B, along with A, you'll have a red, white, and blue Medicare card that says Part A Hospital and Part B Medical, with both of those A and B having an effective date of coverage. Sometimes it's the same date, sometimes it's a different date, depending on when you take Medicare Part B. Generally speaking, Medicare Part B is going to have a monthly premium. Standard premiums for 2026 are $202.90 per person per month. If you take Medicare Part B and you're doing standard premiums, if you're taking Social Security, they're going to automatically deduct the $202.90 out of your Social Security check. If you're not drawing Social Security, they're going to bill you quarterly for Medicare Part B. Now, some people pay more or less than $202.90 depending on their income. If a person is an extremely low earner, they might be eligible for a state program within their state that will cover the $202.90. If a person is considered high income, which for 2026 means as an individual, they make more than $106,000, or as a married couple more than $212,000, you can be assessed IRMA charges, which is an assessment depending on how high your income goes of a higher cost related to your Medicare Part B premiums. It also actually impacts your Medicare Part D as in drug premium as well. It's called Income Related Monthly Adjustment Amount. We can provide you with that full schedule and even how to apply for exceptions if you qualify. So most people are going to be paying the $202.90. For most people, that's going to be deducted out of the Social Security check. If not, it's typically going to be billed quarterly, and then you can set up payments however you wish. You can either pay by check or you can go online and pay by credit card. There's also an option to do auto pay out of your bank. So there's some different alternatives for you to pay that Medicare B premium. However, if you're drawing Social Security, there's only one option, and that's to have it deducted automatically out of that check before you see it. Now, it's often said that in order to get additional coverage, you really need both parts of original Medicare, Part A hospital and Part B medical. It's the price of admission essentially to get the complete Medicare coverage, whatever complete looks like for you. However, Part B is often thought of as not having enough coverage for people in terms of covering their doctor's care, in terms of covering additional services that they would need, prescription drugs, and so forth. And here's the reason for that. Part B covers so many important services. So if you think of anything associated with the word doctor, a doctor's visit, a specialty visit, a lab visit, preventive care, a surgeon's bill, anesthesiology, even outpatient services like mental health or ambulance or emergency room, expensive tests like MRI or CT scans, expensive treatment like chemotherapy, radiation therapy, renal dialysis, those are all under Part B. So it's quite comprehensive in the number of things that it covers. If you ever have any questions to see what it covers, you can always check on Medicare.gov, or we can help you to look at any particular service. Outpatient and physician services, like we just described, carry a 20% coinsurance. What that means is Medicare is going to cover 80%, and you'll have to pay 20% if you only have original Medicare for your coverage. So essentially, you have expensive treatment, the bill is $10,000. In theory, Medicare is paying 80% of that, or $8,000, which is great, but you have to pay $2,000. Now, if that was a one-time deal, maybe it wouldn't be such a big deal. But unfortunately, under Medicare B, without additional coverage, there's no ceiling to the amount you'll pay on the 20%. So that can be very significant. Also under Medicare Part B, as in boy, there's some deductibles just like on Medicare Part A. However, the Part B, as in boy, deductible is very small. So for 2026, the amount is $283. That's not income adjusted. It's a one-time deductible for all of your Part B services. So $283 is a pretty small deductible to pay. That's not usually very intimidating, but 20% coinsurance with no ceiling is one of the key reasons that people get additional coverage, like a supplement or an advantage plan, is to insure against that 20%. Also under Original Medicare Part B, if you see providers that take Medicare but don't accept Medicare assignment or Medicare's reduced rates, they're actually allowed to balance bill for additional costs above and beyond the 20% and the $283 deductible. It's called Part B excess charges, and they can go up to 115% of what Medicare allows, which can mean additional out-of-pocket costs to you if you only have Original Medicare. So a lot of this leads us to think, well, what do we want to have to cover the gaps in Original Medicare? And we're going to touch on that a little later in terms of what you might want to look at for your additional coverage. The other thing to point out about Part B is there's certain things that are not covered at all. For instance, routine dental, routine vision, hearing exams, and hearing aids are not covered on a routine basis under Original Medicare. Medicare doesn't cover annual well woman exams. They do that every 2 years. Annual physicals are not paid under Medicare. They do have something called a new to Medicare wellness visit and annual Medicare wellness checkups, but physicals are not covered. So if you're used to having that and you want that type of coverage, you may have to consider something like an Advantage plan to have the physical. If you're going to go with Original Medicare and a supplemental, you may want to educate yourself on what is covered on the Medicare annual wellness exams and make sure that that's going to be adequate for your needs so that you're not ending up having to self-pay significant costs. The other big thing is Original Medicare A and B do not cover outpatient prescription drugs. So that's something that you have to buy additional coverage to make sure that you're covered for your prescriptions. They call that Medicare Part D as in drug, and there's a couple of different ways to get that coverage. In a nutshell, A and B comprises Original Medicare. When you have Original Medicare, you have a red, white, and blue Medicare card that says Part A, hospital, and Part B, medical. Generally speaking, most people don't pay for Part A. They already paid while working, but most people do pay for Part B. And typically people pay standard premiums. This year, that's $202.90 per person per month. Medicare A and B covers a lot of important services, but it doesn't cover them 100%. There's deductibles, co-insurances, and excess charges, and that's why getting additional coverage often makes sense. There are things that are not covered at all under Original Medicare A and B, things like outpatient prescription drugs, dental, vision, and hearing, which leaves you looking for additional solutions to cover those important benefits. Now, it's always good to contact us if you have questions. You can reach us at reservations with an S at blackpointinsurance.com. You can also look at our website at blackpointinsurance.com or give us a call 415-328-0385. Thank you, everybody. Let's learn more about A and B.